I'm Rob Raymundi, a prosthodontist, and I'm just a dentist. Today, episode of our podcast is discussing all things dental caries, better known as cavities. So we're going to try to give a comprehensive approach here and view of what a cavity is, where do they come from, what causes them, what kind of symptoms you may go through when you have them. We'll go through how us dentists diagnose them, how you may know you have one, and then we'll try to talk about how you can prevent them and things you can do to lower your incidence of getting tooth decay. And then we'll end just touching on a few of the ways we treat them. But here, the goal of this, and when we sat down with the team going over what we wanted to connect with you all about, is really giving you the understanding of what a cavity is, what causes tooth decay, and then some of the things that you can do to help to lessen your chances of getting them and things you can do to help to hopefully avoid them. So we have here a video that you can be watching us on YouTube if you are, or through our website if you're watching this. If not, if you're just listening to it, you can go to our website and we'll be mentioning some images and figures throughout the podcast. So you can take a look at some of the things if you're not able to look at them right now, if you're driving or going for a run or whatever you may be doing. But if you're watching us on YouTube or through our website, you can see some of the figures that will pop up through the video. So we'll start with the first one, exactly what is tooth decay? What is a cavity? And what does it mean when someone tells you you have one? So one of the reasons we decided to start with tooth decay is that 60% of all the money spent on dentistry goes to treating tooth decay. A little less than 20% goes to treat periodontal disease. So the most of the efforts that you may be putting into your dental care may be around treating cavities. So we thought this would be a good place to start to try to discuss all the things that go into what causes tooth decay and cavities. So we'll start with what exactly is a cavity. So if you think of the sense of the word quite literally, it's a hole in your tooth. And we think about cavities or caries as an actual disease process where it starts with a hole in your tooth and then it will progress to becoming larger in size over time. And so cavitation can start in the tooth and then the disease can progress. It's important to realize that early lesions are actually reversible. And sometimes your dentist may say, well, we're watching this here. It's not quite big enough. And we'll go into how you can prevent that. But there is a little bit of a process of interaction of demineralization, the decay starting, the tooth breaking apart, and then your body and you being able to remineralize that. So actually rebuild the broken tooth or the missing tooth surface and the molecules itself. So there's a progression of the process of a cavity of starting from the bacteria adhering to the tooth, colonizing, and then decalcifying, demineralizing the tooth itself, the tooth becoming what we call a white lesion, and then progressing to penetrate the enamel and penetrate the dentin. If you can look at the image, you can see this triangular-like structure going from the outside to the inside of the tooth, the peak of the triangle pointing into the tooth, and that's kind of a classic lesion of how we see it progress. Almost works its way inward and penetrates through into the dentin and then has the same type of colonization effect where it bursts out and then inward and deeper. And while this is happening through the enamel, it's a slow process. Your enamel is the densest, hardest material in your body. And so the penetration of the bacteria into the enamel is quite slow. And once it reaches the dentin, which is less hard than the enamel, the inorganic content is less. It's more organic, more hydrated. The bacterial culture, the cavity, the decay can actually move faster. And so one thing to notice is that in adolescents and children's, tooth decay ends up starting mostly on the chewing surfaces. Opportunistic bacteria can break through on the grooves in your teeth and break into the enamel and through it into the dentin to cause decay there. On adults, we typically get decay between our teeth. One reason why flossing or cleaning between your teeth is so important. And then as we get to the later stages of life, they can occur on all the smooth surfaces of our teeth. So on the cheek surfaces, on the tongue surfaces, and all the smooth surfaces of our mouth. One of the things that can influence the progression of tooth decay and caries is acid. Acid has one of the largest influences in the progression starting and, like I said, progression of the disease itself. For you, you can start with eating acidic food. Every time we eat and throughout the day, our tooth loses mineral, and then our saliva is able to buffer it and remineralize the actual tooth itself. So there's this constant interplay of breaking apart and rebuilding our teeth. And in the presence of acid, it can actually slow down the process because there's less mineral available, and it can continually break apart the teeth. Saliva has a great ability to buffer the acidic effects of food and beverages, but as you increase the quantity, your saliva loses the ability to buffer it, and this can contribute to the breakdown of your tooth by softening your teeth and allowing for opportunistic bacteria to actually penetrate it. So it's important to think about when you eat a meal, your teeth become softer and demineralized, and then in the time following the meal, you get a burst of saliva, and that actually works to remineralize or rebuild the tooth surface itself. So you have this incident of a meal, soften the tooth, breaks apart the teeth somewhat, and then the mineral content in your saliva can help to rebuild the tooth. So kind of how you're eating, what you're eating, how long you're eating, and then how hydrated you are and how much saliva you have all plays an effect in the health and stability of your mouth within that whole experience of before you eat, eating, and then after you eat. It's not just the moment of what you ate that affects it, but it's the whole process of the before, during, and after. And as the acid, the pH is lower, it allows for acid-loving bacteria and organisms to live. And so the more acid you have, the more comfortable these organisms are living. And the more that they can flourish and make their own acid, that helps to cause the effect of progressing disease and progressing these cavities. So the more acidic your mouth is over the more amount of time, the more the bacteria can progress and cause more tooth decay throughout your mouth. There are mostly two bacteria that cause the decay. The predominant species is Strep mutans, and this is by far the majority of the species that cause tooth decay. So it's a good thing is as we get later on our podcast here is that you can see if you target these specific bacteria, you can do things to help to prevent and lessen tooth decay. The other are lactobacillus. So you really have these two bacteria that are affecting the disease here, where in other areas of your mouth, you might have like periodontal disease, more players involved. And so the introduction of acid and the bacteria will actually cause the cavitation and the physical hole in the tooth itself. And that is simply what we call a cavity. It's an actual hole. In our interaction with patients, we talk a lot about acid and pH. So 7 is neutral. The water you're drinking is probably 7 or a little more, unless you're drinking an alkaline water that the pH might be on the bottle, right? Some say above 8, above 9, above 11, 10, whatever it is. We talk a lot about acid with our patients and specifically the pH of the things that we're enjoying or consuming. And so water is 7 to 8 is neutral essentially. And sometimes we're drinking alkaline water, which is higher. And a lot of times we're drinking a beverage that is acidic and a lower pH. At 5.5 and below, our enamel starts to break down. Our dentin is affected about 6.2 to 6.4 a pH. And the cementum, which is where the root anchors into, and some of us who have recession have exposed cementum, that's about 6.7. So the enamel, again, is the hardest substance and the most protective, but as we age and as our teeth wear and as decay can penetrate, the other surfaces, the dentin and cementum, dissolve and are affected at a much higher pH, much closer to neutral. Your saliva can buffer this, and that's one of the most important reasons for staying hydrated and making sure that you give yourself an opportunity to break down the meals that you're eating from a carbohydrate standpoint, but to also buffer the acid. And so luckily, for good and bad, the most consumed beverage in our country is bottled water. I'm glad it's bottled water if it's a good quality water. There's a lot of conversations right now happening with microplastics. We're not going to get into that, of course. Today we're talking about tooth decay. And after that is carbonated beverages. And so most carbonated beverages are acidic. The typical pH of a carbonated beverage ranges from 2.5 to 3.5. So you can see that a beverage of such, if you're sipping it throughout the day, if it's on your desk, if you're out and about drinking something, a sparkling water or a soft drink, that this is something that is going to combat a healthy mouth. It's going to really interact with bacteria and the texture of your teeth, the crystalline structure of your teeth, and help to break it down and allow for opportunistic bacteria to penetrate it. And it has to do a lot with the quantity of it and how well your saliva can buffer it. Coffee is typically a pH of 4.8 to 5. And it's funny, like the fourth most common beverage in our country is beer. when we were doing this research, I came across the most commonly consumed beverages, and beer is on the list of every country. We're pretty high up there. And beer ranges depending on the type of beer you're drinking. A darker beer typically is more acidic. A lighter beer is less acidic. So somewhere like 3 to 6 pH. So like a lager or something like that is less acidic, where a porter or a stout, I guess, maybe Guinness, right, would be a 3.0, somewhere around there. So a lot of the things that we enjoy are acidic. So one strategy you can do is couple it with some neutral water, tap water, a bottled water where you know what the pH is. That's really easy to find out. If you can Google what you're consuming, you can find out what the pH of a beverage is that you're enjoying, and to see that, to make sure that you're balancing off the thing that you're enjoying that may not be as beneficial for your mouth. The other thing that we all enjoy that has a big impact in tooth decay and cavities is carbohydrates. When the bacteria that cause tooth decay comes in contact with carbohydrates, when disease-causing, decay-causing bacteria come in contact with carbohydrates, they create acid. This acid is actually what causes the disease of tooth decay, or causes the cavity itself. So ingest acid can contribute to the environment of tooth decay. And then along with carbohydrates, the bacteria themselves make acid that causes the tooth decay. So it's this mixture of carbohydrates and acid that causes people to become susceptible and eventually develop tooth decay or cavities. I like to think about this with our patients when we come down to carbohydrates is the quantity and the quality of carbohydrates, right? So there's the type of carbohydrates that you're enjoying, and then there's how long you're enjoying it for. The quality would be a gummy bear to chocolate to potato chip. Sticky sugars are the worst. Dried fruits and things like Skittles, gummy bears are by far the most contributory to cavities, because they can stay, obviously, it's just logic, right? It can just stay on the tooth. It sticks on it, allows the bacteria to eat it longer, where something like chocolate is somewhat more dissolvable, along with something like a potato chip, which has less actual carbohydrates available to it, even though it is a source. So the quality matters, but most important is the actual duration of how you're enjoying it, right? How long you're exposing your teeth and the bacteria to the food source of carbohydrates has a more contributory effect than having a one-time or 15-minute incident. So if you took the same volume of carbohydrates and the same character of carbohydrates, so if you took a pile of gummy bears and you ate it in one sitting over the course of 10 minutes, that would have less of an impact if you snacking on gummy bears over the course of 2 hours. Or a beverage, right? If you were to drink something acidic or carbohydrates in one instance over a short period of time, it'll have less of an effect than if you're sipping coffee, sipping soda throughout the day. That'll have a more of an effect because you're feeding the bacteria. You're not allowing your saliva to buffer. We evolved by having meals. So when we have a meal and you look at the burst of saliva that occurs at the environment of your mouth from an acidic standpoint and the bacteria, you'll see that you'll get a burst of bacteria, the acid will increase, the pH will drop, the acid quantity will increase, and then your saliva will start flowing for the next 20, 30 minutes, and that will help to buffer everything, and you'll come to a steady state back to neutral. But if you're having a meal and then you have a cup of coffee or a carbonated beverage for the next hour, 2 or 3, your saliva will not continuously buffer. It goes through that burst and then tapers off, and it's not really, our salivary glands aren't so much built for continuous flow to balance off things. It's more evolved or developed to respond to a stimulus and then go on and then shut off. So by far, in our treating patients, we find that acid and carbohydrates are the two things that you can control the most by shifting your behavior and being aware of it. You have the most profound effect by preventing cavities by avoiding or changing or modifying your behavior, like we spoke about, by drinking water, by being careful with the quality of it. The next thing that contributes is dry mouth. It might be less controllable because you're taking medication, or as we age, the quality and quantity of our saliva decreases. So there are some things that you cannot do to avoid a dry mouth, but by making sure you remain hydrated, you will give yourself the best chance of having a high quantity of saliva, which will help to buffer the acid, the bacteria, carbohydrates in your mouth. As I mentioned, medications can decrease the amount of saliva you have. One of the most common side effects of medications is a dry mouth. So those of us taking high blood pressure medication, anxiety medication, antihistamines, decongestants, and pain medications all reduce the quantity of saliva that you have. You can try to offset it as much as you can, like I said, by staying hydrated. Alcohol and tobacco also are dehydrating to the tissues in your mouth and decrease the amount of saliva. So we have acid, the acidic environment, carbohydrates, and of course the amount of saliva in your mouth that contribute to tooth decay and cavities. The next thing, and it's been interesting as a clinician having a conversation with patients around this, is your genetic predisposition to develop tooth disease and tooth decay. And someone will say to you, oh, I have my father's teeth. He had a lot of cavities and I had a lot of cavities. So to unpackage that, it's like, what does that mean, right? What about your genetics makes you more predisposed to getting cavities? Are there things, and what are those things? It's quite interesting to talk about, because in my early days as a clinician, I would always wonder what that meant and how I could help that person, right? And so the one thing that we found is that it's not a single thing that you could be genetically predisposed to that will make you more likely to get cavities. There's actually a handful of things that can result in you being more genetically predisposed to getting tooth decay or cavities. In a 2015 review article, and we'll put the link in our show notes, they stated that it ranges from 20 to 65% of influence of your genes to actually attribute to getting tooth decay. It's like it's a wide range, right? And so there's a handful of studies, and there's a decent amount of twin studies out there, but it's really hard to put the line in the sand between where the environment is contributing and where it's your genetics. It's really hard because environmental factors will always influence tooth disease, or the cavities will always influence. So it's not the kind of thing that we can solely understand the pure genetic influence. But there are some things that you may have genetically that will make you less or more predisposed to getting cavities. And the first one is the actual density of the crystals of your tooth, soft teeth versus hard teeth. There are some people that the enamel and dentin has formed more densely, and that'll make them less likely to getting cavities. This is a genetic issue here, where there are some people that the crystalline structure of the hard tissues of your mouth, the enamel and dentin, are softer. They're less dense. They're softer and make you more likely to getting tooth disease and tooth decay. And so the actual inherited variation in the enamel that you have can influence you getting cavities or not. The next part of being genetically predisposed is, I find so interesting, and it's actually have to do with taste. One group of individuals have a different reaction to fructose, where you're actually less tolerant to fructose genetically, and that'll be correlated to your taste. And so you might be someone who does not like things that are very sweet, and can actually be genetically predisposed, and therefore you'll be ingesting less carbohydrates. So it's this relationship between your genetic predisposition that changes the environment of your mouth that makes you less likely to actually get cavities. Another thing about taste, separate than the fructose intolerance, is the quality of your taste. So this is something that I think is so interesting, is that they talked about it a lot. And it's mentioned in a 2010 study, and they classify people into 3 different types of tasters. A group that are non-tasters, a group that are medium tasters, and a group that are super tasters. You may have been out to dinner with someone and they claim that they're a super taster, or they can taste everything. Or you may have been out to dinner with people and they ask for spice and salt and more sweet or more sugar. And so we have found that people who are non-tasters genetically add more things to their food. And they may add more sugar and enjoy things that some medium or super tasters find sweeter, where these individuals will not. And so this study found that the non-tasters, since they're ingesting more carbohydrates, have a higher incidence of cavities. And the people who are the super tasters are less likely to eat sweet things. And so sometimes we think, oh, I like savory, or I like salty or sweet, whatever it may be. But there may actually be a genetic predisposition of what type of food you like to ingest. And so when we look at the genetic predisposition to getting cavities, there's a role of what your environment will be based on your genetic predisposition, based off of what your activities are. So I have to think as a clinician that you can mostly overcome your predisposition if it's not structural, like people who have softer enamel, if it's more an incidence of what you would cause you to consume more carbohydrates, that you can overcome a good deal of your genetic predisposition. So I want to encourage you that if your parent or your siblings suffer from a lot of cavities, maybe look at the behavior that happens around that. maybe look at what you're consuming, your acid and carbohydrates. And now you may have done everything and you get it no matter what, so you may not be able to avoid it. But I would like to encourage you to try to think that you may be able to influence it more than your genetics may. That's my overall take on my work with treating patients and taking care of them, is to encourage you to do everything you can and to not give it up to your genetics that I'm going to get cavities because my parent did or because my siblings do, to try to do everything that you can to avoid it. And I think you'll be in a better position because of it, even if you do get some tooth decay and some cavities, regardless of everything that you try. The other part around genetics that is found in the literature is actually your habits at home. Now, this is not a genetic thing, obviously, but it falls under kind of what you're given beyond just your actual immediate environment. But your familial habits at home and your home care that is instructed to you at an early age can have an effect on you through your life. And people who have better home care have less cavities, people who have worse home care. So part of that happened to do with how you were when you were growing up and how we help our children take care of their teeth. So I'll encourage you to form really great habits with them around that. And lastly, which we won't dive into too much on this topic here, but I can't overstate the importance, is your own bacterial microflora, your own healthy bacteria in your mouth, and how that contributes to the bad bacteria being opportunistic and being able to overcome your healthy bacteria, overcome the spaces in your mouth to cause tooth disease or tooth decay. And so one thing that we're doing in the office with all of our patients is incorporating probiotics into their home hygiene care. And we'll get into that in a later recording, but it's something that I think is really important, understated, it's underappreciated in the whole spectrum of going through periodontal disease, cavities, and all sorts of different types of disease processes in our body. And we have an opportunity, if we can maintain our own healthy microflora, the right bugs in the right balance in our mouth and throughout our body, to maintaining a high level of health because of that. As we interact with our patients, and as I want you to think about, there's a real handful there of things that contribute to cavities. There's multiple things that you can try to strategize against and consider your behavior and the things that go into it that can help prevent or help to make you more likely to get cavities. And so we'll jump to the next topic here. And the next part of this conversation is, what are the symptoms of tooth decay? There aren't many. Most disease processes in our body, they are silent to our observational conscious sense. And it's a painless process starting, and you'll be unaware of it most of the time. Once in a while, we get a patient who has a very small cavity and they become aware of it. Is that from the cavity itself or the bacteria around the gum tissue that then becomes sensitive? Not sure. But more frequently, when I find a cavity or tooth decay on a patient, they are unaware of it. And so it's part of the problem with the process, right? Once they progress to a larger size, then they start becoming sensitive to cold and sweet. And then, of course, as the culture of bacteria, the size of the lesion gets larger, closer to the nerve, it can become more sensitive and then eventually painful. So this ties into the next thing we're going to talk about, and it's, how do you find cavities? If it's not something that you can yourself observe and know that you have it, it's how do we work with our patients? How do you work with your healthcare professionals to find and diagnose if you have decay or not? So how do we as dentists detect a cavity, and how do we confirm that you have one? Is the first thing is that we visually look in your mouth, right? We can visually look at the teeth and look at the pattern and the way the light reflects through the enamel. We can look at the color of the enamel. As we mentioned before, a lesion that's progressing to tooth decay is become like a white spot lesion before it actually cavitation really penetrates and occurs. So you can look for decalcified enamel. You can, of course, feel it, as you may have experienced your dentist feeling your teeth to feel a texture. That's a lesion that you can appreciate is not a reversible lesion, because by probing into a reversible lesion or a reversible cavity, you can actually damage it and prevent it from remineralizing. So the first thing is, of course, visually inspecting with your hygienist and your dentist, looking at your tooth surfaces. The next thing is by visually looking at a radiograph. So if you've been to a dentist, you've had x-rays. And so it's a two-dimensional picture of your tooth. And what we're looking for is the different shades of grays, right? It's black to white and shades of gray in a radiograph, and that denotes density. And so we're looking for change of density along with the pattern and shape of that change of density. So we mentioned previously cavity will move into the tooth like a triangular fashion. And you could see that actually in the x-ray as it breaks through the enamel and then into the dentin. There'll be these two triangles, almost two pyramids that penetrate the tooth. So it's the type of lesion you're looking for, the location of the lesion, whether on the top of the tooth or on the side of the tooth. And you need to sit down and look at the radiograph and try to evaluate it. Now, radiographs are interesting, right? Radiographs over time are extremely helpful. And sometimes a single radiograph isn't as clear. As we look at the literature of the sensitivity and specificity radiographs, we can see that the amount of true positives on an x-ray is about 50%. True negatives around 82%. So we're talking about this source of information that, no pun intended, isn't black and white. We have to use radiographs as part of the information of making decisions and knowing that it's not going to catch all lesions. And there'll also be things that look like lesions, look like cavities that are not. Just saw a patient earlier today that looked like she had a couple cavities and they were actually old fillings. Looked exactly like a cavity, the exact location and position, but there was a filling in the tooth that did not show up on the x-ray. So we had to, clinically look at the tooth and realize that it wasn't decay. So an x-ray by itself isn't clear enough to make the determination all of the time. And this is where there's some introduction of AI in dentistry with reading radiographs. And so what AI in dentistry will do is it'll highlight areas for the dentist and hygienist to review. It won't make the call whether it is an actual cavity or not, but it'll show the dentist, the healthcare professional, it'll show them what lesions look like tooth decay, and then you'll have to use the actual information to figure out if it is or not, right? It'll enhance our ability to read radiographs. So with radiographs, we're looking at the positive predictive value and the negative predictive value. We're looking at how sensitive the test is, how specific the test is with radiographs. So right, a highly sensitive test means there are fewer false negatives. A highly specific test means there are few false positives. And so radiographs are not perfect. I think they're an essential part of an exam, an essential part in diagnosing tooth decay, dental disease of all types. Luckily in dentistry, the radiation right now is extremely low. Just this year, the American Dental Association removed the necessity for wearing lead aprons because they found the amount of scatter is so minimal, if any. So we do get pushback sometimes clinically from patients around radiographs. And to be quite honest, it's a little confusion for me because I think it's a necessary part of the exam. You're missing so much by not taking radiographs, and the amount of radiation is near negligible around radiographs and radiation. I won't get into it here, but I could tell you that they're safe and probably safer than if you have an actual infection in your mouth and letting that progress. For diagnosing cavities, I feel like over 90% of that is done like with a clinical exam and a radiographic exam. We have other things in dentistry that can be used. Right now, I feel the most reliable way of diagnosing is a proper clinical evaluation exam with radiographs. There are products out there that your dentist may have, or you may have seen that can be used to interpret the way a tooth looks. There are chemical stains, chemical signatures that the bacteria that cause cavities can give off. And so when you shine certain lights upon it, it may reflect differently. There are photothermal devices that can put infrared heat through the tooth, and the way that it reflects off, it evaluates it. There's a device called the diagnodent that uses laser fluorescence that can give you a reading. This has a very high sensitivity, but it's not very specific. So this type of technology has a very large number of false positives. There's an LED technology that can actually shine light on the tooth, and healthy would shine in a green light and unhealthy in a red light. And there's some pretty good science around this, but it wasn't able to be actually executed reliably. Quantitative light influenced fluorescence is probably the most reliable source or reliable way of looking at a tooth and interpreting data to see if you have a cavity or not. But just unfortunately, there hasn't been a way to execute this in a patient's mouth reliably and consistently with a product to market. And so there are cameras, there are devices, but these should be all used as an adjunct. So if you're a patient going through this, you want to ask your healthcare professional, what is the reliability of this test? What is the information they're getting from it? And what are they using to let you know that they are believing that you have a cavity there before acting on it? And I think that it's important that dentists and hygienists realize that these machines and devices aren't completely reliable. To use them as a piece of information, to not use them as get a reading, there's decay for sure. So you have to take the whole clinical picture in mind. If you have a person take an individual who has never had a cavity and you're getting readings from a device or on an x-ray. So now we'll get into the actual process a little bit about what's happening with the cavity and your biofilm, which is just one of the things that causes tooth disease of all sorts. And it's just helpful to talk about it for a moment and dive a little deep into it, because when we talk about modalities of preventing or treating the process of getting a cavity, a little understanding of this process, I think, helps with understanding how things work to balance it off. And so we're talking about biofilm management. And what is biofilm? The biofilm is what happens kind of after you brush your teeth, immediately starting that bacteria starts to culture your teeth and form a biofilm layer. And so the point of flossing and brushing is to break up that biofilm, to break up the cultures of bacteria. And so what will happen is you'll get a congregation of bacteria that will then form this whole community. In a sense, it'll form this kind of sac, and your development of a membrane around it, and it'll actually can share different things in and out of it. It can transfer. So when you eat, it can take in carbohydrates, and then after you eat, over the next few hours, it can actually start digesting the carbohydrates. And this is, like I said, this biofilm management forms these plaques around your teeth of bacteria communities, and they can actually help to develop their own self and break into the tooth by the process of making acid. Over 400 different species of bacteria can make up these biofilms. And again, brushing and flossing can break them up and remove them. Near immediately after you're finished, they start to form again. That's why we like to recommend brushing a couple times a day, by not waiting too long to brush, and making sure you floss daily to break up the biofilm, to break up the bacteria, to lessen the acid around your gum tissue and your teeth, preventing periodontal disease and cavities. They actually make for kids and for adults these little tablets that you can buy on Amazon or online, and you put them in your mouth, and it'll actually adhere to plaque, which is where these biofilm communities have grown to a larger sense. To see, you can do it before you brush, and then brush and floss regularly and evaluate where you're missing. You may have had this done at your dentist, or you've seen they do it with your children. It's not a bad thing to get at home and to do your regular routine, and then have one of these tablets to see if you're missing places. Probably a very responsible thing to do. There's not one specific one that we suggest over the others, but you can kind of take a look online and try or some and see what you like. And so with that, we'll jump into some of the modalities to treat cavities. So one of the things that are pretty popular and used mostly for children at this point is silver nitrate and silver diamide fluoride. Silver is the active ingredient here. Like some athletic brands put silver in their clothing, in their apparel, to help. It's antimicrobial. This is an off-label use. It's actually not approved through the FDA to treat cavities. And like I said, it's typically used in children because what happens is it'll oxidize. The silver will oxidize within the cavity, helping to kill the bacteria. The consequence of that is it's going to turn the area black. It turns it quite dark. It does produce some fluoride, and it helps to maintain the lesion in a stable place and not allow it to progress. But the color and the look of the tooth is not very viable for an adult tooth, of course. There's been some use of iodine to help to make the color less black, but that also has been found to lessen the antimicrobial action of the silver. So maybe using your children, it's not used by and large in adults. And so we talked about the demineralization and remineralization of your tooth. And so the actual mineral crystalline content of your tooth, and we'll put a figure here, is hydroxyapatite. It's a calcium phosphate and hydroxy group, and that's a crystalline structure. And then once this biofilm, once this bacterial congregation is creating acid onto the tooth, it breaks apart that crystalline structure, and it actually absorbs it into the matrix. And when you're ingesting things like fluoride can actually enter the biofilm and then penetrate into the crystalline structure of your tooth, binding with phosphate and the hydroxy group to form fluoroapatite. So you're getting a progression of crystalline structure from hydroxyapatite to fluoroapatite, and that brings us to fluoride. Fluoride is the most popular medicinal product used in dentistry, by and large, as most of you know, to help to strengthen your teeth and help to prevent or lessen the amount of cavities that you're getting. And so again, we're getting a transition from hydroxyapatite to fluoroapatite. They found that in fluoride in drinking water, there's a 25% reduction in cavities. The interesting thing about fluoride is it's not just helping on a crystalline structure level. It's actually helping in a few different ways, besides just giving the building blocks of the tooth to bind stronger than the calcium was. The fluoride actually reduces the metabolism of the bacteria in the biofilm. It can actually prevent some of the enzymes of the bacteria from working properly, which prevents them from growing. And then in addition to just the act of forming the fluoroapatite crystals, preventing the bacteria and the adhesion of the biofilm, it can break it up just from that mechanical action also. So you're causing the tooth to get stronger, you're reducing the biofilm ability to adhere to the tooth, and you're breaking up some of the enzymes in the biofilm, in the bacteria also. So you get this like really nice effect from the fluoride of balancing off and lessening the ability of the biofilm to take action on your tooth. So there is a question about how much fluoride is enough and what are the proper dosages of fluoride. So we'll put this chart here. If you think about the dose makes the poison, there's a therapeutic dose and then the dose that is too much. And touch on some studies in a moment around that. But for the typical adult, you'd want 3 to 4 milligrams of fluoride. You have a single serving on your toothbrush, you're going to have about 1 to 1.5 milligrams. So if you're getting about 1 to 1.5 milligrams, you might be underdosing if you're only brushing once or twice a day. Personally, what I like to do is after flossing, I'll rinse with a fluoride rinse and then brush my teeth with a fluoride or hydroxyapatite toothpaste. And I feel like that's going to help to expose my tooth surface to the amount of fluoride that I need to strengthen. There are treatments at your dentist that you can receive called the fluoride varnish treatment, and it's painting somewhere between 2 to 5% fluoride onto your tooth. When contacting your saliva, it gets a little sticky and hardens, and over the course of several hours after being applied to your teeth, it helps to strengthen your teeth. The literature around fluoride treatments show that fluoride varnish treatments may be the most effective way to administrate fluoride to your teeth and may have the lowest incidence of tooth decay associated with any fluoride treatments. And you may not realize it, but some of the foods that we ingest have fluoride. Tea and coffee are amongst the things that we enjoy that have the largest percentage of fluoride, believe it or not. So you may have heard that drinking some types of tea may reduce the rates of getting cavities. Well, that's one of the reasons why. It's actually that there's fluoride in the tea that is delivered to your tooth to help it strengthen things. As you may have heard in some other podcasts around fluoride, that there's quite confusion around fluoride and debates, where there's some places in the country that they're trying to remove the fluoride, some are trying to add the fluoride to drinking water, and for some reason this becomes a point of contention or opinion out there. So I'm not sure what's right or what's wrong, but what we can do is go to literature around fluoride and try to make some decisions around that. I also think on the decision you have to make personally is how do you want to expose yourself and your family to fluoride? I think the literature is very strong that to support fluoride for decreasing cavities. And so how you administer it may be the more important question, not the question of do you administer or not to your children. The question may not be should my children have fluoride or not. Maybe it's important that after using fluoride products, they rinse well, making sure when they're younger you supervise them, or you yourself if you're worried about fluoride. Personally, I like to use fluoride in part of my oral hygiene regimen, but if you are worried about it, you can simply rinse with some water afterwards to help to dissolve it and get it out of your system so you're not having a systemic involvement, even though there is some pretty good studies about the quantity of fluoride that is safe and not safe. The studies around fluoride in drinking water show that there's a reduction in cavities when it's in the water. The levels matter a lot. And so some places find that there's a reduction of 20, 30%. Some find higher, some find lower. There's some really good studies out of Australia that show about a 12, 11% reduction in cavities in adults. Another study out of Australia showed 24% reduction in adults. And this is around 0.5 to 1 milligram of fluoride in the water. In the US, about 75% of the water is fluoridated, and it has around 0.7 milligrams of fluoride is kind of like the average. There are websites that you can go and find what your water fluoridation level is, and so you can look that up and search for that online. I think it's important to know what the quantity is in where the water you're drinking. And so in my home, I have a water filter that filters the water coming into our house that we're drinking. So that's filtering out most of the water actually. So that may be good or bad depending on what your opinion is of fluoride and what the quantity is in where you live. If it's too high, it's great to be filtering it out. Most places are not too high, but if you feel it is and you feel it's not safe for your family, filtering your water is an easy way of removing the fluoride. And so, yes, you can get too much fluoride. Too much fluoride can lead to fluorosis of your teeth, right? When you're forming as a child, if you get too much fluoride through supplements, or probably not through your water, but through supplements that you're taking, vitamins, fluoride can get incorporated in your teeth, changing the appearance of your tooth surface. It can become white, not as shiny. There are cases of people getting too much fluoride into their bones and making weaker bones. But typically, in the average situation, just in drinking water, you're not going to have that level of fluoride that's going to contribute to these types of issues. So we'll also put some tables here and some charts about the recommended fluoride dosing. It's worth looking at the chart because it ranges so much through life from birth to being an adult. It really ranges. And so there's so many contributory factors here with how much toothpaste you're using, what the fluoride content is in your water, and where you are in your life. So you have to put it all together to figure out on what dosage is right and how to proceed with this. And working with your pediatrician or your physician and your dentist, if you're worried about this, to make a position. I think it's something that is possibly over worried about based on the literature, but it's still something to be informed about if it's something you are indeed worried about. And no judgment either way. I just think that it's good to get some measurable information about it so you can make some decisions around it for yourself and your family. A lot of the studies that talk about the adverse effects around fluoride have to tie with IQ. So the reduction in IQ when there is too much fluoride administered to an individual. The study that mentioned this had 11 milligrams per liter in the drinking water, which is many, many times higher than anywhere in the US. We're typically around 0.7 milligrams per liter. The study had 11 milligrams per liter. The dose makes the poison, and this study, it was a poisonous dose in a sense, right? And this is not many places that you can actually ingest this amount of fluoride without deliberately doing it. But even with that one study, there are other studies that are conflicting that show no involvement of fluoride with IQ reduction. So for those that are concerned, avoid fluoride. If you're not, do not, and more or less find out the information. And for the people who are sensitive, I do have patients that have fluoride aversion once in a while. And again, we just suggest rinsing out after using the fluoride. And the good news is that there may be some other products that are helpful. One product that does not have fluoride is the calcium hydroxide paste called MI paste, mostly available only through dentists, but it can be found online maybe, made by a specific company. And there's really good literature around this. Of all the studies that are done with medicinal toothpastes, there's one specific, and we have no affiliation with this company, through GC America is a branch. GC is a company. They make a product called MI Paste 1. It's a calcium hydroxide paste that has fluoride. It's a toothpaste. And when compared to different toothpaste, fluoride toothpaste or hydroxyapatite toothpaste, this toothpaste has seemed to be the most effective in preventing cavities and tooth decay. Supposed to be only distributed by dentists, but before we recorded this last night, I was looking online a little bit and I found a few sources. So I'm not sure how that works. Not saying you should buy it online. Maybe talk to your dentist before using it. But the MI Paste 1 is the most strongest suggested toothpaste or supported toothpaste through the literature. And for those of you who are worried about fluoride, we have a great solution now called a mineral toothpaste, and that's hydroxyapatite toothpastes. As we spoke previously, your tooth is made of hydroxyapatite crystals, calcium phosphate with a hydroxy group. Well, that is the foundation of your teeth and the crystalline structure of your teeth. So there are toothpastes that can just replenish that. The reason fluoride is used, just to repeat, is that fluoroapatite is a stronger bound compound than hydroxyapatite, 9 to 10 times stronger. And so that's why another reason why fluoride is so popular. But hydroxyapatite is supported pretty well in the literature to be preventative of tooth decay. And so aside from hydroxyapatite preventing cavities, it also naturally helps with tooth sensitivity and naturally makes your teeth look whiter. So personally, I like using hydroxyapatite toothpaste once a day and a fluoride toothpaste the other time of day if I'm brushing twice in the morning and night. And in the middle of the day, whatever, if I can get it in, whatever I'm using. Whatever's closest to me. But I do like alternating those toothpaste because they have different benefits. So hydroxyapatite, the most important part about what you may be purchasing or using around that is that it's nano. It has to be a smaller size hydroxyapatite, 50 nanometers or smaller. They do sell, and I have a little thing about this, they do sell hydroxyapatite toothpaste that do not contain nanoparticles, and there's no therapeutical benefit. It cannot be taken up into your tooth surface. So make sure if you're using hydroxyapatite toothpaste, you're using nano hydroxyapatite. It's actually developed in the 1970s by NASA to help to deal with astronauts losing minerals in your teeth during space trips. So we mentioned that hydroxyapatite toothpaste may help with sensitivity. And what's actually happening here is it's binding to the collagen and the hydroxyapatite crystals into the actual dentin, and it's helping to plug the tubules of the tooth to prevent fluid exchange through the tooth, reducing pressure changes, reducing sensitivity. A few things that have to go through there, but by plugging off those tubules, it can help to decrease sensitivity. And like we said, in many studies, they found that by using hydroxyapatite toothpaste, your tooth can look whiter. The way it binds into the tooth surface can actually make it look a little whiter. So it might be the most effective whitening toothpaste would be a hydroxyapatite toothpaste, where we talk a lot with our patients about whitening toothpaste are abrasive and actually affect the enamel negatively. So if you wanted to look for a whitening toothpaste, I'd recommend using a hydroxyapatite, a nanohydroxyapatite, and it's important that the hydroxyapatite is 10% or more. I personally, again, have no affiliation with this company, but Risewell is the product I like the most. It's 15% nanohydroxyapatite. I find it's a really nice toothpaste. My kids like it. I like to use it. And we'll attach a really nice study here also that was a literature review of a bunch of different projects that compared fluoride toothpaste and hydroxyapatite toothpaste. Again, the ability for this toothpaste to prevent tooth decay is found very similar in the studies as of yet. I think we need some more time to really figure out and ascertain where it lays out. But as of right now, the studies are quite supportive. And so I support my patients using it. Like I said, Risewell is a nice company. Make sure you find out what exactly is in the toothpaste. And since it's a newer type of toothpaste, there's a few different players on the market, and make sure you look into what you're using or what you're trying before you start trying one of those. The next thing we'll get into is a product that is talked about a lot is xylitol. Xylitol is a sugar that is added into products, a sweetener, as replacement of natural sugar or artificial sweeteners to make things taste better. In dentistry, we're using it because of its quality of what it does actually physiologically and mechanistically in the biofilm and bacteria. So xylitol is a 5-carbon sugar, where the other sugars we're using are 6-carbon sugars. Non-caloric sweeteners and table sugar are all ingestible by bacteria, where these 5-carbon sugars are taken into the membrane, and then the bacteria cannot break it down and consume it, and it'll reject it out of the membrane of itself, and then it'll actually take it back in. The cycle happens. And so the cool thing about xylitol is it energetically depletes the bacteria, killing them. So it really targets strep mutans. Strep mutans, the carbohydrate ingesting bacteria that cause tooth decay, cause cavities. It targets them specifically, and it'll help to kill the bacteria. So xylitol is a wonderful low caloric or non-caloric sugar, depending on what your classification is. We'll call it low caloric because there is some calories involved with it. And it's one of the best things that you can do to prevent tooth decay after meals. Our body normally produces 5 to 10 milligrams of xylitol itself. The glycemic index is 7. Glucose is 100. Fructose is 18. So when ingested in proper quantities, there should not be a insulin spike as regardless of this. So recent study came out and it got picked up by the media first, and then it was picked up by a lot of really smart people talking negatively about this study. And the study stated that ingesting xylitol can have adverse health effects. And they had individuals drink a beverage containing 30 grams of xylitol in one sitting, and then measuring the effects and then stating that because of what would happen to your body systemically, there'd be some adverse health effects because of xylitol. And so you can look this up, and me will put a links of a few reactions to it, or a few studies, or a few responses to this, what has been considered a poorly done study for many reasons, which I don't want to waste time right now going into it. But in dentistry, we're recommending that you use a piece of gum or a mint containing xylitol after a meal. And in our products, they contain anywhere from 0.2 to 1 grams. Most are around 0.5 grams. And so the dose makes the poison, just like we're talking about with a few different things here today. And so it's a safe amount of xylitol. It targets the bacteria that cause cavities. It can help to kill them and prevent them from progressing. And there's very minimal absorption to your body systemically. A reduction in the bacteria in your mouth can have a profound effect on your body's health systemically. The disease-causing bacteria in your mouth can travel through your body. Strep mutans can travel to your heart. We have something that can target bacteria that causes tooth disease and tooth decay. It can probably have a positive effect on our systemic health. There aren't many double-blind randomized control studies around xylitol, so the American Dental Association has an unclear feeling about it, right? The evidence is unclear is what they were stating, but from what we can understand physiologically, I think that it's worth something using after a meal on the go if you cannot brush your teeth to help to lower your incidence of tooth decay. And typically, you wouldn't want to exceed 5 to 6 grams daily. Most of the adverse effects found in the literature up until this point were more of a laxative, diarrhea-provoking effect. So the other thing around xylitol is you want to keep it away from your pets. Pets can't exactly digest xylitol, so it heads straight into their bloodstream because they're unable to digest it and not so healthy for pets. So if you have gums or mints, keep them away. I'm hoping that you take away a few of the reasons why you may be getting cavities and tooth decay. I'd like to kind of wrap things up here. So if you can appreciate the things we covered today, and it comes down to the environment of your mouth, biofilm management, the things you can do to try to prevent bacteria from winning the battle and causing cavities in your mouth, from the acidic environment to carbohydrates, to strengthening your teeth, to bringing up the biofilm mechanically by brushing, and then reliably working your dentist to evaluate your mouth clinically to make sure that you do not have cavities that are progressing if they're found to treat them. We have things of preventing decay on children like sealants, and then once, of course, the decay is present, by removing them mechanically and then putting a filling or a crown or an inlay or an onlay on the tooth. And we'll go through this on another podcast in more depth. Just know that a cavity can progress to losing a tooth, or it can be treated before it starts by mechanically breaking up the biofilm by flossing and brushing. Work with your dentist, your hygienist, to make sure that you're doing the things necessary, doing a good job cleaning. You're trying to have a good strategy to manage the good bacteria, bad bacteria in your mouth, and the carbohydrates and the acid quality in your mouth. Thinking about flossing, brushing, the toothpaste that you use, and how much you're using and how often you're doing it. I hope you could take away the things we discussed today to make a really good plan for yourself and to try out a plan and then have it evaluated with your hygienist and your team to make sure you're doing the right job. Please check us out on the website for our show notes where we have some charts and figures related to what we spoke about today. I wish you well. I wish you a clean mouth. I wish you no cavities. And I look forward to connecting with you next time. Thank you for joining us this week. I hope you found it helpful and enjoyable. Please head to our website for our show notes and more information around the topics we discussed today. Please check us out on our YouTube, Instagram, and TikTok pages for weekly updates and other interesting topics we discuss more frequently. The information provided in this podcast is for general information and educational purposes only and is not a substitute for professional advice. Accordingly, before taking any actions based on such information, we encourage you to consult with the appropriate professionals. We do not provide any medical nor health advice. You should seek the full diagnosis and treatment from your healthcare providers for any issues or conditions you may have. No doctor and patient relationship is formed. The use or reliance of any information used from this podcast is solely at your own risk. This podcast is purely for educational and informative purposes only.